Okay. Now, we're familiar with the kind of Big Bang privatisation model. There's a lot of different ways that have been developed by the privatisation specialists around the world over the couple of decades since the big privatisation push has been happening. And we're not going to have a Big Bang privatisation for the NHS, we're going to have a very quiet one.
In the past, we've had all sorts of public health services, such as main drainage and water supply.
What has happened is that all of the rules that control health financing have been gradually changed since the New Labour times, piece after piece put in place with different explanations for each item as to what the purpose of it was.
This new health service will be organised on a national scale as a public responsibility.
But overall, we now have the NHS reorganised in such a way that it can be relaunched as a mixed market, what is called. So not just a public health sector service, also a healthcare industry.
The cost of the service will be met from rates, taxes and national insurance, and so everyone will pay for it, and everyone will benefit from it. When you're ill, you won't have to pay for treatment.
And the rules are structured in such a way that there will be a gradual transition between those two groups. The public sector will shrink away and the private sector will grow.
Just a minute. Where do I come in?
Because there will never be an announcement in Parliament that the NHS is privatised, it is very likely that the general public will not be aware that the private sector has in fact come in and taken over whatever bits of the NHS it finds profitable.
These private equity groups, they come in, they destroy. So you're going to destroy the NHS. Sure, some people get good health care. A few people get private health care, just like a few football players get multi-million-dollar contracts.
Just suppose you fall off your bike.
But the vast majority of those in the healthcare system are going to get slammed.
You might have concussion as well.
They'll get nothing.
You'd be carted off in an ambulance, which might cost a couple of quid.
They'll be on the street. They'll be dead, done.
And then you'd have to pay the hospital too.
But at that point, of course, the private providers just take the NHS logo off, and then they will enjoy the boost to business that will come with the terrible reputation the NHS will have by then.
We are on the right track.
A doctor employed by the company which assesses people for disability benefits has strongly criticised its methods as unfair.
The family and friends of hundreds of patients who died due to neglect in an English hospital are calling for criminal action to be taken against those responsible.
According to the Prime Minister, there are huge numbers of people in this country who support his plans to reform the health service. Perhaps they're all suffering from laryngitis, but one professional body after another has come out against them.
This leaflet is coming through your letterbox one day soon.
Basically, there's been a sweep of privatisation of public services right around the world, applying standard solutions. And we can see that when that happens, the consequences are terrible.
Greg Wood says he felt compelled to speak out after he saw what he claims was medical knowledge being twisted against people.
It's not actually necessarily predatory behaviour by companies that are making the problem at all. It's the incentive system.
Pressure is being put on healthcare professionals to, in many cases, come up with a particular outcome, really regardless of the facts of the case.
If you make sure that medical facilities have no way of making any money other than by selling things, then they become salesmen, not advisors and advocates to the public.
An official report last week found that many people had died needlessly.
That's basically the problem with it. The set of incentives that have been loaded into the NHS in order to enable the creation of a mixed market at the same time completely undermine its ability to be an ongoing decent public service.
At the end of which time we have the Faculty of Public Health, the Royal College of GPs, the BMA, the Royal College of Nurses, the Royal College of Midwives, the Chartered Society of Physiotherapy, the main unions, the Royal College of Anaesthetists, the Royal College of Ophthalmologists, the Royal College of Paediatrics and Child Health, the Royal College of Pathologists, the Royal College of Physicians, the Royal College of Psychiatrists, the Royal College of Radiologists, the College of Occupational Therapists and the British Dietetic Association, all thinking the bill is wrong.
Somebody please think of the children.
Show me where it hurts, and I know that I can be the medicine you need. Maybe I'll be a cure.
We can expect things to develop the way that they are in the States, where you have a situation where a large percentage of the population is just permanently excluded from accessing care.
I'm there. I'm in. Hang on, Coach. Well, let's look at some of the stories emerging from America this past week. Hospitals make money from their own mistakes because insurers pay them for the longer stays and extra care that patients need to treat surgical complications that could have been prevented, a new study finds.
Ah, damn it. Come on. Damn it. Lavage is positive.
A further portion of the population has insurance which turns out not to be adequate to pay out when they actually need to use it, so they're effectively in the same position except that they've already paid an insurance company for nothing.
They found that their surgical error rate was about 5%, and they were looking at ways to reduce the cost of these surgical errors. And what they found was that, in fact, if they reduced surgical errors, their profits would decline.
You know, in the past I found ice in Trellendenberg.
The Trellendenberg? It's one of my favorite places to ski.
The median length of stay for those patients quadrupled to 14 days, and hospital revenue averaged $30,500 more than for patients without complications.
So between that system and the fact that people who do have comprehensive care, the hospitals have a field day because finally somebody can actually pay some sizable bills, so they take the opportunity to get as many tests and procedures on those people as possible.
We're heading in the right direction.
Putting wealth before health is the perception among a swath of British public.
It's a merry-go-round of self-interest.
Members of Parliament, the House of Lords and healthcare companies opening up Britain's National Health Service to plunder by profiteers.
Many of the lawmakers who voted yes have links to private suppliers which stand to benefit.
Private health interests starting to look very seriously at cherry-picking some of the best, most profitable parts of the National Health Service.
Hinchingbrooke made history when it became the first NHS hospital to be managed privately, breaking with the entire concept of a state-run health service which had existed since the end of the Second World War.
All citizens in Britain are in effect covered for all risks from the cradle to the grave.
This hospital may be paid for by the taxpayer, but it's owned by a company now whose investors include hedge funds, and they're very significant donors to the Conservative Party.
You can kind of see that the whole system really is not fit for purpose.
It's run by a group called Circle Health, whose website makes clear that its main investors are these finance houses and hedge funds.
When the government are telling us that this is a good thing to do, it is certainly very good for somebody to do this, but I'm thinking it's not us.
Documents show that the men who invest in Circle Health have also donated nearly $2 million to the Conservative Party.
And that's coming to Britain, it's coming to the NHS in the form of the privatisation of the National Health Service.
Why does my heart go on beating? Why do these eyes of mine cry? Don't